Good morning, this is Natalie Conish and my case study. 55-year-old white male patient is prepping for his annual colonoscopy. His GP discusses with him the preparation before getting a colonoscopy and goes over his PMH and FH. He finds that his father's GP found malignant cells had formed in the tissues of his colon. In addition, polyps were found in his colon. The patient's father was diagnosed with colon cancer. The gastroenterologist performed a total colectomy on his father to remove the malignant cells. The patient's GP told him that it is very important to receive a colonoscopy annually since his father had colon cancer. He tells his patient before the procedure he will need to cleanse his colon of toxins. He suggests he take a laxative to cleanse the colon and not to eat anything for 24 hours before the procedure. The morning of the colonoscopy, the gastroenterologist uses a colonoscope to examine the colon. He finds that there are no signs of any malignant cells or polyps in the colon. The patient's brother drives him home. While the patient is home resting, he starts to feel anxiety, lightheadedness, and tightness in his chest. The patient's brother called for the EMTs to take him to the emergency department, and the RN takes his vital signs at 11 o'clock. His temperature is 99.2, pulse 100, blood pressure 140/90, and respiratory rate 24. The RN calls the MD along with the PA to review symptoms. The RN attaches electrodes to the chest of the patient. The electrodes are wired to an EKG. On the EKG, the MD finds only a few P waves and finds that the heart is beating irregularly. They find that the patient's heart is in atrial fibrillation. The MD comes back every few hours to check the EKG machine. On his third trip, he looks at the EKG machine and finds an elevation of the ST segment or ST elevation myocardial infarction. The MD quickly takes the patient to the catheterization lab. The RN puts an IV in the patient's arm. Again, electrodes are placed on his chest and wired to an EKG machine. The MD uses the femoral approach to insert the catheter and introducer sheath, which were threaded through the arteries of the heart. The cardiologist then injects the contrast material through the catheter into the arteries of the heart, which outlines the heart's vessels, valves, and chambers. The cardiologist finds there is a blockage in the heart. He takes out the catheter and performs coronary bypass surgery. After the patient recovers, the cardiologist finds the patient's heart is still beating irregular. The cardiologist discusses the option of putting in a pacemaker to help regulate the heart. The patient agrees. 24-year-old white female patient sees the gynecologist for her annual Pap test. First, the nurse asks her to give a urine sample using the clean catch urine technique. The patient goes into the restroom with a sterile cup, washes her hands, then sits on the toilet spreading her labia, wipes her labia, and uses another wipe to clean over the opening of the urethra. While keeping her labia spread open, she urinates a small amount into the toilet, then fills the cup halfway with urine. The nurse then takes the urine sample and runs a pregnancy test. While waiting for the pregnancy test, the gynecologist performs the Pap test on the patient. During the test, the doctor uses a speculum to widen the opening of the vagina. Now the doctor examines her cervix and vagina. Cells are collected and tested for any abnormalities. Next, the nurse comes in with the patient's urine sample results and finds that the patient is pregnant. After a few weeks, the patient goes back to her gynecologist to have her first ultrasound of the fetus. Because it is the beginning of her pregnancy, the doctor uses an ultrasound wand to go transvaginal to look at the cervix and fetus. When the fetus is more developed, the doctor uses an ultrasound outside the pelvis. At 6 months, she starts to have a fistula. The doctor recommends bed rest for the rest of her pregnancy. At 7 months, the mother's water breaks and she starts to go into premature labor. She gets rushed to the hospital, and she goes to the maternity ward of the hospital. After the obstetrician examines the patient, they see that she is fully dilated and that the baby is in the breech position. The doctor takes her to the OR where he performs a cesarean to get the baby out. They get the baby out fairly quickly and take him to the NICU. After 2 months of intensive care, the baby is healthy for his mother to take him home. 35-year-old African-American male is brought into the emergency department after being struck by a car while walking across the street. He is unconscious and has an open compound fracture of the leg. Because of this, a cast of the leg can be used. Instead, the orthopedist uses external fixation. Once that is in place, the MD takes him to get a CAT scan. Looking at the film, the technician finds there is an intracranial injury, or TBI. They find there is a contusion, which is causing the patient to be unconscious. After a short period of time, the patient wakes up and is examined by the nurse. She asks him some simple questions and finds he has a slight case of